Okay, today I'm going to do my sterile field introduction of an item to the sterile field, donning and doffing of the sterile gloves, Foley insertion and removal. I'm going to try to get that all done in one video. So here we go. First thing we're going to do is the sterile field. I'm going to knock on the door, make sure everything is okay for me to even come in the first place. I'm going to introduce myself to the patient. I'm going to check for two identifiers, the wristband, ask them their name, and cross-reference that with my MAR to make sure I'm in the right room with the right patient at the right time, about to perform the right procedure for them. And I'm going to perform hand hygiene afterwards or before, and we're going to go into the setting up of the sterile field. I have my sterile drape. I'm going to make sure the packaging hasn't been tampered with. I have been practicing, so in this case, it clearly has been tampered with, but otherwise this would be sealed off. I would check for the date, make sure it hasn't expired. And I have my top sponge. Again, that appears to be sterile, not contaminated, no broken seals or anything. It's not damaged in any way and unexpired. And this is going to be what I introduce to my sterile field. And I know everything is going to be above waist level, because anything below, which in this case this is a low table, ideally it would be above waist level, because anything below the waist is considered unsterile and anything behind me would be considered unsterile. So I'm going to keep everything waist level and in front of me. So we're going to start with the sterile drape. We're going to open it up. And I'm going to make sure that my work surface is clean and dry. So we've got the sterile drape open, and we're going to use pincer grabs because you don't want to be grabbing it all at once, because this is considered sterile at this point. So we're going to open it. Just kind of move that to the side. And you're going to open it in front of you. We got the whole thing open. And we're going to try to maintain, I know that's not the prettiest in the world, but we're trying to maintain a 1-inch margin around the edges. So that's a no-go. Anything on the inside of that is good. Anything on the outside of this is bad. Just this area in the middle. Now we're going to introduce the top sponge. And again, using pincer grabs, because you don't want to be, pincer, yes. I'm very particular about it. And I'm not keeping it in here. Out here, yes. I'm just going to take it and make sure that dropping it inside the center is a no-go. You want to maintain this border. So you want to find the side of it, and as best as you can, kind of flip it. And then that's now my sterile field. Now we're going to move on to catheter insertion and removal, along with sterile glove donning and doffing. So initially I'm going to make sure I have all my supplies gathered that I'm going to need for this procedure. I'm going to knock on the door, introduce myself to the patient, tell them, okay, my name is Nick, I'm going to be your nurse for today, and it appears you have a doctor's order for a Foley insertion. And I'm going to make sure I'm going to check their MAR to make sure this is the right patient, using two identifiers, date of birth, first and last name, and check their wristband. And then carry on from there, perform hand hygiene, before I start touching anything on the patient. And then I want to ask the patient, are they experiencing any pain or discomfort right now before I start? Wolfie's going to say no, because he's a perfect, ideal patient. And again, I have my clean areas, clean and dry, my workspace. I'm going to inform the patient as I'm along the way that if there's anything that I do that causes pain or ask them to do that causes them any pain, that we're going to stop. So first I'm going to ask the patient to expose themselves. I'm going to pull down the blankets, lift up the robe so I can see the work area. And I brought my chuck sheet and I'm going to place the chuck pad in between the patient's leg as to protect their linens on the bed, because this could get a little messy. Now I'm going to move on to my actual kit, which is a self-contained sterile environment. And as you can see, I've already been practicing with it. So ideally, this is not open. I would check to make sure there's a list of everything that's in it. So that's good to go. And everything is not expired. So we're gonna open it up, take this out, and then this will double as a trash bag. And then my sterile kit, we're going to pinch the grass and pull away from us first. And again, not over, off to the side, out. And then the side flap, and the last thing we do is this flap toward us. Again, maintaining a 1-inch margin around, because anything 1 inch and back is no-go. Anything 1 inch and forward is good. It's considered sterile. So we're going to now we have our gloves here. Actually, I'm going to go ahead, slide that over a bit so I have some more space to get my gloves out. Gloves. I'm going to boop and pick the glove up from the inside of the collar. Yeah. I'm gonna go. Oh, wait a minute. No, I think I picked it up the wrong way. Oh gosh, what happened here? Yeah. Now, as I mentioned a few days ago, that these gloves are a bit small, but I have been stretching them out through practice, so maybe they won't be as bad today. Yeah, it looks like I worked them out well and still maintaining the glove sterility here. Then I can go ahead and grab from the inside. I have the glove on this one. Then boom. And now we're ready to move on. This would, I can put this off to the side. And now we're going to set up some more drapes underneath the patient. And it has two sides, a shiny, slick side, and a more absorbent side. I'm going to put the shiny side down, face down. And we have a second drape to put around the meatus of either the vagina or the penis. Again, shiny side will be face down. And so far, we've maintained sterility. And again, we're not reaching over the sterile field because we only have a 1-inch margin to work with. So we'll reach around. Now we have to clean up the perianal area. And we have swab sticks for that. And I'll go ahead and open these up. Have those ready to go. And go ahead and lubricate the end of the Foley kit in advance. So I'm going to open that up, squirt it into the container, and then trash that. Because the more we can set up prior to touching the area, the easier it'll be. Because once this hand touches the area we're working with, I can no longer use this hand, only this hand. So we're going to set up as much as we can with both hands in advance to make it easier on me and quicker for the patient. I'm going to go ahead and remove. Oh, that was really bad. That was really bad. Let's try that again. Typically, I wouldn't have this catheter so close to my patient, but we're in training, so we make mistakes. So ideally, I'm going to ensure that the catheter isn't flinging around like it just did, and then dispose of that into my handy dandy trash. Put this in the lubrication, lube it up real well. So I'll have that sit there. And then we have a 10 milliliter syringe, but for this we only need 5 milliliters to inflate the balloon at the end of this catheter. So we're going to go ahead and pop the top on that and put this syringe into this green connector tube right here. And so now that is ready to go. Now I'm going to take my swabs here . 3 swabs. I'm going to take the area that we're working with, and because this video is so far off, I'm going to bring it a little closer and show you how it would work. We would take it and start from the meatus, and then that's good to go. But now I can't take my hand off, can't take this hand off of the insertion site. And so now I'm going to take the catheter take the catheter that has now been lubricated and insert it with this not down but up. Tell the patient that you're going to feel a little bit of pressure, but it should not hurt. If it hurts, let me know and we'll stop. And we're going to insert this as far as it will go, or until we see urine flow back into the tip of this tube. And then, now that that's in there, we're going to inject up to 5 milliliters of the solution and then remove the tube. I don't know if you can see that, but it's, I believe I remove right at 5. So I'm gonna throw this in the trash, but because I'm gonna need this for the removal, we're gonna put it back here. And then we're going to pull it out until it stops, until we feel resistance, and that means it's good to go. I'm going to ask the patient, do you feel any pain right now? If not, we're good. Then I'm going to clean up my area. So take all of this. I'm going to leave that here for the removal. So, clean that up. That in the trash. I go ahead and cover the patient up. Take the bag here and hang it off to the side of the bed and use this clip to secure it to the inner thigh of the patient. I'm so sorry, this is not ideal. And then boom, secure this, the tube to the leg, hang the bag off to the side of the bed, return the patient to their normal clothed and uncompromised state, and make sure that you put the bed, make sure you don't hang the bag on the any movable part of the bed, because you don't want it to snag, and make sure that this bag is below waist level and not above for gravity's sake, because you don't want any backflow to occur while this catheter is inserted. And we're going to cover them back up and ask them, do you need anything further at this time? And then leave. And while we're at it, I'm going to go ahead and remove my sterile gloves. And then those go in the trash. And we're good, because I would have cleaned up all of this. All of this would have gone in the trash as well. Perform hand hygiene, and we're good. Now I come back to remove the indwelling catheter. And this procedure is not a sterile procedure, so I don't need to don sterile gloves again at this time. Knock, knock. Introduce myself. I'm Nick. I'll be your nurse today. Looks like you have an order for me to remove the catheter and perform hand hygiene, get my 2 identifiers like I did previously, date of birth, first and last name, and check their bracelet. Go ahead and put down my chuck pad, and I would probably put on regular gloves, but they don't have to be sterile gloves, but I don't have any extra gloves right now. So we're just going to pretend I'm wearing gloves because we're going to be touching the patient. So chuck pad to preserve the integrity of the linens. And chuck pad. Go ahead and, because I'm wearing gloves, so it's kind of weird to do this without actually wearing gloves. But got the absorbent pad underneath. You're going to check the bladder, dump it in the appropriate receptacle, and chart it. So Now this is empty and has been removed, or well, I guess you didn't remove it, you just emptied it at the very least, according to your location's procedure. So now that is empty. Now we have to address the balloon that is inside. And again, you're explaining to them this whole time. You may feel a little pressure, but it shouldn't hurt. Have them expose themselves if at all possible. If not, I'm going to be the person that would have exposed and pulled the sheets down, lifted the robe up. You use a brand new syringe, not one that was already used like this one, but you use the same connection. And what you'll do is withdraw as much water or solution as you can, and then you would squirt it out and then go back a second time just to be sure, because the last thing you want to do is pull out a bladder that was not completely deflated and cause a lot of pain and possible injury to the patient. So now we would have double checked that all 10 milligrams of the solution are back in the syringe as it originally was when we did the insertion. And then again, I'm wearing gloves. I'm going to pull it out and make sure you're not flinging it around, and then you're going to remove your gloves and keep in a manner that will cover up this area here. But before that, you're going to inspect the area to make sure everything was still intact and that you didn't leave anything inside your patient. So now that that has been covered, all of this is going to go in its appropriate receptacle, and then you proceed to perform perianal care. And I do believe that concludes everything. Perform perianal care. I'm going to touch you, clean the area, then return them back to a normal, safe position. Bring their sheets back up, pull their gown back down, and chart everything at the end, and perform hand hygiene because you just touched, bodily fluids, and ask them, is there anything else you need before I go? All right, and then you're done. Again, of course, I would have cleaned up all of my trash. This would not have been here. So I hope that was everything.